Hi, my name is Patrick Solomon, and this is my psychology in film assignment. Mark Grayson is the main protagonist for the show Invincible, which the show will be talking about. He started as a high school student that inherited powers from his father, Nolan, an alien from the Viltrumite race. The series takes place in a modern society where superheroes are publicly known and are defenders for global security. This setting places Mark in a constant high pressure environment where violence is a norm and morals get complicated. Throughout the show, Mark tries to balance a regular teenage life alongside the extreme demands and psychological stress that entails being a superhero. So, what is a diagnosis? If Mark had to visit a psychologist, the diagnosis would be post traumatic stress disorder, or in short, PTSD. Is it diagnosed in all other cultures? Not really. It depends on the culture. In some cultures, PTSD shows up more as a physical symptom rather than an emotional one. Others may focus on spiritual related explanations. But overall, not all countries have equal access to mental health professionals. Talking about intrusive thoughts and emotions is less common in other cultures since mental health is very stigmatized. What are the stigmas in our culture? Compared to other cultures, the US shows very little stigma towards mental health. Although it is sprinkled in here and there, it is mostly dependent on the person's individual beliefs rather than more of a horde mentality, at least from my perspective. Men are often discouraged from expressing vulnerability, while women are taken less seriously or labeled as emotional. Different communities within the US may have additional layers of stigma because some families discourage talking about it. Some people may not trust healthcare systems, or maybe it's just easier to bottle it in. But for Mark Grayson, this kind of cultural backdrop helps explain why he tends to internalize his trauma. He keeps pushing forward, avoids fully processing what he's been through, and feels pressure to stay strong, and uses classic responses shaped not just by trauma, but by the expectations of the people he surrounds himself with. So, what is a proposed treatment plan? A strong treatment plan for Mark would include trauma focused cognitive behavioral therapy, or TFCBT for short, and possibly eye movement desensitization and reprocessing, EMDR for short, both commonly used for post traumatic stress disorder. TFCBT would help him identify and reframe negative thought patterns, especially guilt and self blame, while EMDR could help him process traumatic memories, such as violent battles and his father's betrayal. In addition, incorporating support systems like trusted friends, family, or even other heroes would be important to reduce isolation. If symptoms are severe, medications such as antidepressants could also be considered. But why is this treatment appropriate? This approach is appropriate because Mark's struggles are rooted in repeated trauma, emotional guilt, and high stress. TFCBT directly targets distorted thinking, such as Mark blaming himself for the deaths he couldn't prevent in the show, while EMDR is effective for reducing the emotional intensity of traumatic memories. These treatments would help him better regulate his emotions, reduce anxiety, and improve his ability to function both as a superhero and as a normal person. But what are the ethical concerns? There are several ethical concerns in treating Mark. First, confidentiality is a major issue because he is a public superhero. Revealing his identity or mental health struggles could put him or others at risk. Second, informed consent may be complicated due to his age, as he starts to show as a teenager and grows into his 20s, as long as the show is gone. So, not for too long. Third, therapists will need to consider dual responsibilities, since Mark's actions directly affect public safety, and balancing patient privacy with potential harm to others could be difficult. But what are the barriers to the treatment? Several situational and cultural barriers could prevent Mark from receiving proper care. His lifestyle as a superhero means he has little time for consistent therapy and is constantly exposed to new trauma, interrupting that progress. Culturally, the expectation to be strong and resilient may discourage him from seeking help. There's also likely a stigma around mental health, making him more likely to internalize his struggles. Finally, his unique identity as being half of Viltrumite may make it difficult to find professionals who truly understand or are equipped to treat his experiences. Accuracy of the portrayal. In Invincible, Mark Grayson shows many reactions that align realistically with PTSD, such as guilt, emotional distress after violence, and difficulty coping with repeated trauma. The show does a better job than many superhero stories by not brushing off the psychological consequences of violence. However, it's not fully accurate. Mark often continues functioning at a high level almost immediately after extreme trauma, which in real life would likely cause more prolonged impairment. And the speed of his recovery and ability to keep fighting and underplay how debilitating PTSD can be for many people. But what is its influence of media portrayals and cultural perspectives? When the media shows characters pushing through trauma quickly, it can create unrealistic expectations that people should bounce back fast or handle trauma alone. On the positive side, showing emotional struggle at all can reduce stigma and can make mental health more visible. Looking more broadly, whether we label Mark's behavior as a disorder can depend on cultural context. In American culture, its symptoms would likely be recognized clinically as PTSD. But in another culture, especially one where trauma is normalized or expressed differently, his reactions might be seen as a normal response to extreme circumstances rather than a diagnosable condition. This shows that while disorders like PTSD are globally recognized, cultural beliefs strongly influence how we interpret, label, and respond to psychological distress. And these are my sources. Thank you.